Dr. Dave, a pleasure to see you again. As a huge fan from Reality Sandwich, we're always closely following your work and the interesting things you're doing for the space.
It's great to be here with you, Kyle. Thanks for having me.
Yeah, of course. As part of our new Share Your Experience series, I'd really like to talk to you today about a particular patient experience that I feel inspired you to want to dive into the plant medicine scene and where that's taken your research and what you're doing now.
Yeah, I love talking about this stuff because I think the experiences that we see with our patients and friends and family through their own personal healing process is so, it's, you learn more from those kinds of experiences, and especially we do as clinicians and doctors than we do through any other experiences. And because we often see so many people go through these experiences. And this kind of my initiation into the world of psychedelic medicine really came in 2012 when I first started to hear about the surfacing of MDMA use recreationally. And back in 2012, I think it was estimated that there were something like 500,000 new users of MDMA in the United States every year. So this is a huge number. That number went up to 1 million by 2016. And that's just from survey studies, but it's interesting nonetheless. And I started to, as I was working with patients at that time and starting to work with more patients in the Department of Psychiatry who were veterans and folks struggling with severe PTSD, and just seeing the treatment responses that these folks were having were not particularly great with the tools we had available. And, we're taught to use antidepressant medication and benzodiazepines and all of these pharmaceutical cocktails that are fine for stabilization purposes, but they're not good long-term solutions for the problems that our patients with PTSD are suffering from. And I started to look outside the box for other tools that had evidence behind them that could maybe have less side effects that were supportive of healing in people with PTSD. Because most of our patients, just to put real numbers to it, over 70% of our patients who are treated with the standard of care for PTSD in the United States currently are not actually getting better. They're still sick after experiencing, 2 or more full courses of standard treatment. So most people are not getting better, and that's real bad. It's like over 70% of people who are not getting better long term. So I started to explore three areas, really. Natural techniques that people were using to get to feelings of comfort in their bodies. So this was like soothing touch, soothing music, yoga, meditation, breath work, all the ancient stuff. And then looking at technology and what technology had added to that over the last 70 years. So that was like biofeedback, neurofeedback, EMDR, and a lot of these interesting vagal nerve stimulation, all of these interesting technical tools that had less side effects than drugs that were capable of relieving symptoms in people with PTSD. And then I found MDMA-assisted therapy, which was in the MAPS phase 2 trials at that time. And we were seeing the patients in these trials who had on average 17.6 years of treatment-resistant PTSD. We were seeing 54% of them enter symptom remission at 2 months out, and that number went up to 67% at 1 year out without any additional treatment. And the phase 3 trials that were just completed last year, I believe, showed a 88% response rate in a similar population. So this is the complete opposite result of what we were seeing with the standard medications we were using. And working with a lot of these veterans and seeing people really get over the hump of recovery, but also to the point where they were feeling so much better, they were able to start taking on more of the healing journey on themselves and start doing more of the work themselves, was truly inspiring. Like we saw people's lives completely change to go from not being able to even come to the dinner table with your family because you're so overwhelmed and stressed out and triggered, that these people were now eating dinner with their family every night. And they were applying to jobs, working jobs. They were becoming, fulfilled in life as a result of these 3 doses of MDMA and just 42 hours of psychotherapy in the MAPS protocol. And this was really astounding. It was, to me, seeing these results come back and be published in mainstream medical journals was it highlighted MDMA therapy as one of the most successful treatments we've ever had, if not the most, for any mental illness in the last 100 years. I mean, it's really an astounding figure of how well people improve as a result of the therapy done right. And so it was really that, and then working with patients and getting trained in that practice and ketamine therapy, where I actually started working with people going through these experiences that just concreted all of that for me and helped me learn how to study MDMA and how MDMA works, which led to the development of Apollo.
What was the reaction, from colleagues and other people in the space as you started to want to research and share, what you saw working? I'm sure, again, we're still coming out of the war on drugs here. I'm sure some colleagues were taken aback when you mentioned, ketamine and MDMA, and curious, how you're helping break the stigma in the actual medical community.
Yeah, without a doubt. I mean, I think, especially going back to 2012, there weren't that many publications out yet. 2016, there were more. Phase 2 trial results from MAP started to come out then. Now we have even more big publications that have come out. So I think it's definitely gotten easier to convince the mainstream medical community of the benefits of these practices, these psychedelic therapy practices. However, when I first started doing this back in 2012, nobody had any idea about what I was talking about or what was being talked about in the literature. People were very closed off to it. And, I think it's understandable because of how paradigm shifting these molecules are, right? Like when you look at the way that antidepressants like Prozac and Zoloft work, the SSRI family, they work by stabilizing an individual by kind of numbing them a little bit to the negatives, but they also numb you a little bit to the positives, which is why people get side effects. So the numbing can be helpful, or the reduction of sensitivity to negative things, negative concepts, thoughts, feelings can be helpful in the stabilization process. But people require the drugs for life because, for instance, if you broke your leg and then you went to the doctor, and rather than fixing the leg, which is painful, cleaning out the wound, and then putting it into a cast, they just said, here, take this pain medication for life. And by the way, when you stop taking that pain medication, your chances of relapse are 70, 80%, and you're going to be symptomatic again. We would never do that, right? That would be completely unethical to treat physical pain that way and physical wounds that way. And your leg would still be broken when you stop taking the pain medication. Medication doesn't fix that. So, you have to go through the surgical process of having your leg fixed, and then you get the medicine as well. And it's the combination of the therapy plus the medicine that actually results in a healed leg. That there's PT involved, right? Physical therapy. There's other kinds of things involved that help you get to walking again and running again. And we don't have that for emotional health. It just has never existed. So, especially going back to 2012, it was thought that at that time, that you could still just give medication to people who were diagnosed with a mental illness and they would just get better, but they had to keep taking the medicine. So it was a very similar model to just giving pain meds for a broken leg. There's still an emotional wound underneath the surface that has to be addressed. And if we don't take care of it, then you take the brakes off, right? You take the SSRI off at the end of the treatment course, and people still have a broken, shattered emotional pieces of themselves that need to be repaired. And so MDMA therapy, now that we're understanding a lot more of it, and psilocybin therapy and other psychedelic molecules like ketamine, they actually help us to address the core traumatic wound. And it's a root cause source of the problem treatment program. And that is the first time we've ever had anything like that for mental health. So I think, again, it's not surprising that people were resistant to it when these results first started coming out. But now that there's so many more studies proving the efficacy of things like ketamine and MDMA for depression and PTSD, respectively, it's hard to deny that these medicines are breakthrough for mental illness.
What is your particular protocol that you've researched and studied now with some of these plant medicine therapies? What is the process of somebody going through this?
So we actually wrote a review article on this. It was published in the special psychedelics issue of Journal of Affective Disorders in 2023. There is not currently a lot of standardization around psychedelic therapy protocols. There are a lot of people who say my therapy style is better than your therapy style, and there's a lot of argument about that. But I think if we're really going to look hard at the evidence, it's very clear that the MAPS, Multidisciplinary Association of Psychedelic Studies, that has pushed MDMA through the FDA so successfully so far, has the best protocol to date for making sure people have the most successful, most transformative, most healing, safe psychedelic experiences. And that protocol is a combination of different forms of psychotherapy. So it's motivational interviewing, it's cognitive behavioral therapy, it's interpersonal therapy, it's internal family systems, it's a whole bunch, psychodynamic, psychoanalytic, it's all a whole bunch of different types of psychotherapy that are tuned for the individual, but in a more non-directive way. So we're not actually actively interpreting things for people. We're not telling them what to think or what to do, which sometimes comes out in therapy. We're just trying to help them figure it out on their own based on these therapy models that have been around for decades that work really well. And I think what we're going to find, and the MAPS protocol also has two therapists, usually one male, one female, but not always. The two therapist model is actually really important for the best practices for the patient, because something happens in therapy when, especially in general therapy for trauma, but especially with psychedelic medicines, where people are in an extremely vulnerable state. And when they have a therapist, for instance, like that reminds them of a parent that traumatized them, then they can react to that person, that therapist, as if they are the parent, and they're kind of like reliving the experience. And we call that transference or countertransference. And it's a really important term. It's like where I'm like in some ways projecting my emotions onto you and then acting out a role with you that is not actually who you are, but you're kind of playing that therapeutic person for me to process my stuff. And the problem is when you only have one therapist in the room and that therapist gets targeted, then it's very, very challenging, even without drugs like MDMA on board, to help the client navigate through those experiences, because you're targeted now. So the patient doesn't see you anymore as a therapist. They see you as that person who might have traumatized them or caused some issue in their lives that they're trying to deal with. And it can create either great obstruction to healing, or it can create great healing opportunity when you have another therapist there to diffuse the transference. Mm-hmm. And so then you have a third party who can sit there and say, hey, let's unpack some of this, right? Let's role play it out. Let's figure it out together. And then you actually process it and work through it. And it helps create these really powerful healing experiences for people. So I think the two therapist model is absolutely critical. It's called a dyadic therapy model, combining a bunch of different forms of psychotherapy for whatever the patient's needs are. And then also starting to think about preparation and therapy during the experience. So preparation for the experience itself, like at least 2 or 3 sessions, preparing the person for what they're going to experience when the medicine's on board. Then actual therapy during the experience with MDMA, so that there's support and people there to unpack anything that comes up. And then also integration afterwards, where people are actually talking about and unpacking everything they learned from the medicine experience with the therapist afterwards, and gaining perspective and figuring out how to take what they learn and actually put it into place in their lives.
Super wonderful to hear. It sounds like you're really the thought leader behind who's going to establish these protocols.
I mean, I think it's a group effort, right? So, we have a nonprofit 501c3 medical board that has published on this work, because it's important to put this, best practices out there based on what we know to date. And we're working with other organizations to help create collaborative agreement on what are the minimum best practices for safety with our patients and getting to best outcomes. But it's not something that like myself or any individual can just come in and say, this is how we're doing it, because nobody likes that. And that's not how medicine works. So our medical board is publishing and researching on this with world-renowned experts that are from the psychedelic community, but also from the general medical community, so that we can facilitate adoption and education of the general medical community. And then we're also working with folks at world-renowned institutions like Yale, Hopkins, NYU, and other places, try to actually implement some of these trainings in the real world and get people more up to speed and more, at least at the bare minimum, able to have a conversation with your patients about why or why not psychedelic therapy. And this is how to understand it. And this is how to learn more. And that's a huge gap right now, where if you or I went to our doctors and said, hey, I'm interested in psychedelic therapy, what can you tell me? Like 90% of doctors would tell you no, or I don't know. Sorry, go find somebody else to talk to. And your doctor is supposed to be the person who's supposed to be able to answer these questions for you, right? So if we're going to maintain trust in the medical system, the Western medical system, and not have an exodus of people leaving to go get care elsewhere to self-medicate, we have to make sure we're educating our doctors and our clinicians to have these hard conversations with our patients.
So I'm curious then. I'm sure as you've seen the quote psychedelic industry seems to be offering right now a lot of training courses. There seems to be a lot of coursework out there about becoming a psychedelic integration coach or having these certificates out there available. Some companies have, gone under and kind of were bad actors in the space. So I'm curious on your current thoughts on who's out there right now and why you think, what your thoughts are on these courses people are offering.
Yeah, I mean, it's a complicated area, right? Because with any new industry comes a lot of opportunity, and there's a lot of people who want to take advantage of that opportunity to make money. And so there are a lot of folks out there who are not necessarily bad actors, but they're just trying to like leverage the opportunity to make some cash. And they're not necessarily providing the best product. And then there are other groups out there that are doing a really, really good job providing ultra high quality information. And those are the groups you really want to follow and pay attention to. So, those groups are the groups that are considered to be what we call CE and CME accredited organizations, or they have coursework in the psychedelic space that is both CE, continuing education, and CME, continuing medical education, accredited. And that is a good sign that the organization that you're getting trained by is actually reputable. There are some others that don't have that accreditation that are also reputable, but that's a really good place to start. One of my MAPS obviously has great trainings that are accredited. The Ketamine Research Foundation and Ketamine Psychotherapy Associates has great trainings that are accredited, and that's specifically for ketamine therapy. Psychedelic.support has great trainings that are accredited. We work with Psychedelic.support for getting their online trainings through the Board of Medicine out to general medical providers to help educate doctors to talk with their patients, just like I mentioned earlier, and make sure that people know they can get medical training credits, which all of us doctors need to get to maintain our licensure. We can get those credits by taking Psychedelic.support accredited coursework. So that's really great. And then, there's a few others, a few and far between, but I think the major thing to look for is to start with these accredited organizations. Psychedelic.support, run by Ali Fiducia and her partner, Sean, have probably done the best job across the board of compiling the best psychedelic education courses that are accredited that actually are reputable. So for anybody who's new to this area, before you go to MAPS, before you go to the Ketamine Research Foundation, check out psychedelic.support, do the online coursework, or at least explore it. And then when you're ready for your in-person coursework, or in-person trainings, that's when you want to check out like psychedelic.support, or MAPS, or when they open their trainings again, or Ketamine Research Foundation, or Embodied Life with Lauren Taus. That's also an awesome training that I've helped to train at. So there's a few others that are really good that we can recommend, but psychedelic.support is a great resource.
I'd love for you to share a personal experience or story, whether that's from a patient you've worked with and their experience with plant medicine therapy, or even, I'd love to hear some stories about other doctors who have come to you. Look, I have people asking me, what do I do here?
Yeah, it's a great question. Well, I'll tell you one of my most favorite patient anecdotes, just to give you an idea and your audience an idea of how powerful ketamine therapy can be, because I think a lot of people think, oh, ketamine, it's an anesthetic, it's a horse tranquilizer, it's not as effective as the other psychedelic medicines. This is entirely untrue. Ketamine was originally developed for human use about 70 years ago, and it was used in humans to evacuate wounded soldiers from battle in Vietnam. And then it was used for anesthesia in the OR because it's a much more gentle anesthetic drug to like put you under for surgery. If you're a woman, a child, or somebody, an adult or person who's doesn't tolerate traditional inhaled or IV anesthesia well, ketamine can be used with less side effects. So ketamine is a really powerful drug that had its psychedelic therapy effects actually that were discovered somewhat by chance through clinicians testing it on themselves, which is really interesting. And so ketamine is a 60 to 90 minute experience. It's extremely safe. It's low dose compared to what is given in the hospital. And it's just an amount given to take you really just to like the threshold of psychedelic state, which is this profound state of quiet mind. So really just having a quiet, almost dreamlike experience where you can kind of, without this constant chatter of your brain going on. You can just listen and watch yourself doing the things and thinking the things you do and feeling. And as you start to have that perspective shift, you start to learn a lot about yourself just from watching and listening with a quiet mind. And it's a state that many people have never felt they can get to until they experience it with ketamine, which is really interesting. And so one of my favorite patients is a late 40s, grew up in a cult in the Midwest. And she was in the cult with her husband, they're married in the cult, married young. And they grew up in the cult for decades, their entire childhood, all the way up through their early 30s, I believe. And they were completely indoctrinated by the cult.
Wow.
They didn't have any friends or family outside of it. They were told there was no one for them outside, right? It was like a very closed in group. And then they realized at some point in their 30s that, hey, there is actually more to the world beyond what we were told. And so they left. And they were completely excommunicated from their friends, family. They had no one on the outside. And they had to start life over for themselves. And this was a huge traumatic event for them, not just being raised in that kind of environment, but also the leaving of it and the loss of their family and friends connections and support, zero support, no money, right? And so they started their own business. They did really well for themselves. And then COVID hit. And their business was dramatically affected by COVID because of the kind of business that it was. And so the wife ended up seeing me for care. And she had never done a psychedelic in her entire life. And she had a religious inclination, but had a very estranged relationship with God and with religion because of the way she was indoctrinated and brought up in the cult. And so she wasn't sure if she could still have a relationship with God because God was associated with her upbringing
Wow.
and her background and the brainwashing and everything that happens with a cult upbringing. And so we did a couple preparation sessions, and she had no idea what she was going to experience with the medicine. And we did one ketamine session with her. And on the very first ketamine session that we did together, it lasted at about an hour, 90 minutes. And at the very end, she sat up and she said a couple things that were really just incredibly resonant, and insightful and funny. And the first one was that she had repaired her relationship with God by meeting God in the experience, by able to observe for her what God meant in the experience and be able to have what ketamine does, which is it's a dissociative anesthetic. So it's allowed her brain to separate her idea of God and the concept of spirituality from her cult upbringing. She could see the separation and know that those were not together. And she was able to allow the cult upbringing piece to be let go and forgive herself for not leaving sooner and all the other things that go along with that, and allow herself to see that her connection to God and spirituality was actually independent of that entirely and something that she can completely nurture within herself on her own just by believing in it. And it changed her entire life. And that was that single experience. And that was, she continued. I think she did maybe 3 or 4 more experiences, but none were quite as profound as the first. But the other thing she said at the end of the first experience, which was one of my favorite quotes from a patient ever, is when she sat up, she says, "I get it now. I get everything." And I'm like, "We're like, what do you get? What came to you?" She's like, "I get how the Beatles made all their music."
Oh, wow.
She was also
Transcendent.
right. She was also a musician and a creative herself. So, she was like having this experience of her mind quieting and then seeing all the connections that her brain would be able to make without this constant suppression of herself by her past trauma. And it was just, if I can feel this now, I know this feeling is within me. I can do the things I need to do to get there. And she implemented everything immediately. She followed through the whole protocol and she just completely transformed. And now her business is fully operational again, generating enough revenue to support her and her family. And she is back at it full force.
It's beautiful to hear truly the healing and potential of ketamine therapy there.
Yeah, we're not talking anything small either, right? We're talking like 30 something years of cult brainwashing that ketamine just dissolved for her enough for a short amount of time for her to remake meaning around what that relationship was and remove the sense of fault and guilt and shame that she had in herself that she was carrying around for decades that was holding her back, right? And so it's not insignificant. Like, this is a really powerful experience people can have. And when everybody asks me, I think one of the most common questions is, what psychedelic should I start with first? Like right now, if I'm struggling or I have a friend who's struggling, I always say ketamine, because if you have a good ketamine provider and therapist, we can do just as good work with you that we can do with MDMA and psilocybin and other drugs. The therapy is like 80% of the experience. So making sure that you find that right person to work with can change everything.
That was truly a beautiful story. That's awesome. Awesome to hear. What is your post, I'd say, protocol after somebody does a few sessions? Do you find anybody ever coming back, or what is do you find after a few sessions they're quote ready?
Yeah, so I'd be remiss if I didn't talk a little bit about how our protocol, which is based fundamentally on the MAPS, 2 therapists, 1 female, 1 male per patient protocol. It's all that standard. But if I didn't talk about how it's a bit different, I think people would be missing out. So one of the 2 major differences in our protocol that add on to the MAPS protocol is, number 1, I've studied with indigenous tribal leaders in different tribal communities, particularly in South America. And I've learned a lot from the way that they treat trauma with ayahuasca and the way that they practice tribal medicine for healing. And there was a ton that I learned that helped inform my clinical practice I didn't see brought into clinical work with psychedelics or otherwise. And I brought it in. And there's examples of this in lots of different indigenous cultures, but my favorite example is from Shipibo culture in Peru, which is one of the oldest tribal medicine cultures in Peru that works with ayahuasca. And they talk about something called the 4 pillars, which I've kind of adapted to the 4 pillars of self-trust, or of rebuilding self-trust. And these 4 pillars include 4 key emotional skills that we can all strengthen over time simply by practicing them anywhere we are, whatever we're doing. And those skills are self-gratitude, number 1, self-forgiveness, number 2, self-compassion, number 3, and self-love, number 4. And that simply by just starting with gratitude and just finding things in your life to be grateful for, or especially about yourself to be grateful for, as much as you can, you're strengthening that gratitude muscle in your brain, which directs your attention to more things you can be grateful for rather than more things that are holding you back or making you feel bad or making you feel afraid or whatever it is, making you feel out of control. So this is a fundamental brain training exercise that is actually becoming validated through studies of gratitude in Western medicine. That is super cool, and it's super easy, or it's totally free, right? So that was one in particular indigenous practice that's my favorite that we brought in. And we see great responses with patients using this before, during, and after the ketamine experiences. And because it gives them an anchor of tools, a toolbox they can use and lean on, an emotional toolbox wherever they go. And then the other tool that we use is Apollo, which I'm wearing on my chest right now. Apollo is the first wearable technology to be used alongside psychedelic medicines to improve outcomes from psychedelic therapy, help people navigate their way through challenging and bad trips, and also to help people integrate afterwards and drop in before by calming the body using soothing sound waves that are delivered to the skin or to the body. And we discovered it through my research into MDMA we were talking about earlier, by understanding that MDMA works in the brain in animals and humans, from what we can tell so far, by amplifying neural cascades of safety. Neural pathways of safety in the brain get amplified by MDMA, which then amplifies the safety of the therapeutic container or experience that results in people feeling safe enough to go back and remake meaning around past traumatic events and what it means about them. So that's fundamentally the basis of how MDMA works. So when I was studying this back in 2014 through 2018, I got my MDMA training, we went back to the lab, and we figured out how to replicate something like 40 to 60% of that safety benefit of MDMA by delivering these soothing vibrations to the body that are activating of the vagus nerve system and the safety response system in the body, just like soothing touch. And you can wear this anytime before, during, or after treatment. So we actually give this to people the first day that they come in. They have Apollo, whether they're in the office or they're at home, and they use it to condition their bodies, train their bodies to be in a more recovery, more safe, more embodied state going into the psychedelic experience. by the time they actually get to the medicine administration session, they're usually noticing that they're starting to feel a little bit better, combined with Apollo, combined with the preparatory psychotherapy and the 4 pillars and that kind of thing. They're starting to notice just a little teensy something, right? Just like a little bit. So they're kind of like ready for what the medicine has to show them. And then there's less resistance. So they're ready to like really drop in, and they're feeling comfortable with the unknown of what's going to happen with this experience because they've had this practiced embodiment with Apollo. And before we had Apollo, we just used breath work for this. We have to teach every single patient how to breathe properly and just try to get them to practice it at home every single day. But most people don't do it. So this really it doesn't take the place of breath work, but it helps to make sure that people are able to get some of that autonomic training that breathwork offers by making it easier, wearable, less effortful. And then people can still breathe with Apollo, and it works even better, and it trains your breathing, but you don't have to take time out of your day to use it. And so and so now Apollo has actually been used in thousands of ketamine patients over the last 4 years, and in ketamine clinics, because it's a wellness product. So ketamine clinicians are giving it to their patients like we are before, during, and after. And it's actually helping integration quite a bit from psychedelic experiences, because when you use Apollo after, especially if you use it during and before, it reminds you and your body of that embodied feeling that you had when you were under the influence of the medicine. And now you can take that with you. So we're in a trial with MAPS now, actually testing the benefits of Apollo to improve PTSD symptoms in the time frame after MDMA therapy is over. And that study is currently recruiting. So if anybody here is listening to this and you want to get involved in this, if you've been in a PTSD MDMA study with MAPS, you are actually eligible for a free Apollo and participate in our study if you would like. So please do reach out to us, because we'd love to have you as a part of it.
Wonderful. I really love, the case study you have with this. It seems to reflect on the association, really the power of human touch that really these patients need.
Yeah,
and
absolutely.
then I like the association as well with the therapy. I think that's an important component as well.
Yeah, absolutely. And and that's what's so interesting when you actually get down to like the core neuroscience of what's happening, right? Like what's happening in the brain and the body when we have these MDMA experiences or these really powerful therapy experiences with our therapist or with a friend or a loved one, or when we get a hug, right? What's happening when we hear our favorite song? And if you actually map out the nervous system pathway from the ears to the brain, the skin to the brain, the eyes, empathy system to the brain, it's an MDMA, it's all doing the same thing. It's all activating the same safety parts of the brain and the same emotional cortex as MDMA is doing, just in a slightly different way. And so when you think about the natural ways that we feel safe, soothing touch, soothing music, these are all soothing sensations in general are at the core of how we make sure we're safe and comfortable in our own skin. And breathing does it too, right? But breathing takes time and practice. So having more tools in our toolbox that are technology-based, updated tools is really cool, because we actually start to see people have tremendous benefit with Apollo, whether they're using MDMA or ketamine or not. And the more we can make these experiences safe and palatable for people and acceptable, the better.
I'm curious of your finding, especially working with patients with PTSD, after they've received specific plant medicine, what was their use of cannabis for treating this, whether before they started protocols with you, after, and I feel like cannabis is tying its way into the plant medicine protocols, and again, just with its popular use as well.
Yeah, it's an interesting question. I think cannabis does not just mean THC, for one thing. Mm-hmm. So just to get that out there on the forefront, CBD is part of cannabis, other THC compounds, but most of cannabis is non-psychoactive cannabinoids. And then there's the THC, which is what most people know of as what gets you high, right? And you can get cannabis product that's helpful for people that does not have THC in it. It doesn't get you high, but it does relax you, calm the body, decrease inflammation, improve emotion regulation and sleep, but no high. And that is really important to understand, because I think a lot of people don't necessarily realize that cannabis doesn't always have to be the kind you smoke and, get all crazy and wily, right? So there are therapeutic uses of both. I think cannabis in general, with THC and low THC, has been used for PTSD and by PTSD patients, not in medicine mostly, but by PTSD patients in the wild through exemptions through the federal government and state governments for decades. It was used for mental health and for physical health issues as a mainstay of medicine prior to 1910. So back in the early 1900s, cannabis was actually a mainstay of mental and physical health treatment. It was in all the pharmacopoeias that all doctors received, and it was considered to be a standard of care. But then, of course, the politicalization of all happened. And after alcohol prohibition failed, Anslinger still needed to keep his job. And so what did he do? He said, well, we're going to prohibit cannabis because mostly minorities use it. And it allows us an opportunity to prosecute minorities, which is incredibly racist policy that still exists to this day. I can't deny that that's where it came from, because that's where it came from. And ultimately, we're still in a state of our country that has a lot of rules and regulations around plants and medicine that criminalize plants, which is egregious and totally inappropriate to criminalize plants, especially plants that have indigenous healing properties. And it's very racist, and it's really terrible. But cannabis has a lot of benefit for lots of different medical conditions. I think it's going to take years now for the medical community to catch up and show that there are significant trials showing how exactly to use cannabis for all the different things. But I think I can tell you, for specific rare seizure disorders in children, CBD is extremely effective with good quality CBD. It's more effective than any Western medicine that we have for those conditions like Dravet syndrome, and then chronic pain conditions, which PTSD and chronic pain often go hand in hand. And those folks have tremendous benefit from using cannabis with THC and cannabis without THC or with low levels of THC. I think the general evidence to date would suggest, and we just published a paper on this for chronic pain management and opioid use disorder management in Harm Reduction Journal in 23 from the Board of Medicine, showing that the evidence base for cannabis strongly suggests that for chronic pain and for lots of different chronic pain disorders and opioid use disorder, that starting out with low THC to no THC cannabis products that are high in CBD, CBG, CBC, for sleep, cannabinol, CBN, and some of these other cannabinoids that are not psychoactive are the best place to start for patients. They have the lowest risk, if no risk at all. And they're the best place to start. And then they actually have a pretty good likelihood of having benefit. And then in the course of like a month or two. And if they don't, then we can add THC on and start to try to amplify the benefit. But it certainly seems that THC plus the other cannabinoids are really the sweet spot and work better together. But not everybody needs THC. So that's kind of where we're at right now.
Right. Wonderful. Curious again if you have any particular patient experience who've shared with you, their breakthrough with cannabis or using it as part of their continued protocol.
Oh yeah, there's been a lot. I mean, I think, cannabis is also interesting because cannabis can be used as cannabis is psychedelic, right? Mm-hmm. There are lots of people who don't talk about cannabis like it's a psychedelic, but it is, especially when we're talking about high THC containing cannabis, it's a full-blown psychedelic experience for many people. If psychedelic means to reveal the mind and psyche means mind, delos means to reveal, right? Cannabis is doing just that. So especially THC. So we have a lot of patients who use cannabis products, but cannabis is not used in the psychedelic-assisted therapy context en masse right now, even though it's widely available. There haven't been a lot of protocols put out for how to use cannabis and THC and cannabinoids for psychedelic-assisted therapy. So most of what we see with the therapeutic benefits of cannabis that I think are really tremendous are people who have chronic pain and PTSD who were so sick and tried everything, nothing worked. They were so suicidal. A lot of veterans in particular I've seen like this, where I had a patient who was so suicidal and in so much pain all the time, mental and emotional and physical, that he just couldn't go on, right? He couldn't work. He didn't want to live anymore. He couldn't work. He couldn't spend time with his family, that he was enjoying himself. They weren't enjoying themselves around him because he was in such a bad state all the time. And the only time he felt good was when he was like snuggling his service dog, And that is no way to live. And, his physical pain, while we were doing the emotional pain work, his physical pain was a real challenge to navigate. And it made his sleep bad, and it made him more irritable and frustrated during the day. And it just made everything worse. And we didn't have any good solutions for it because this person could not take opioids because they had had a history of severe opioid abuse. And so, and there weren't any other molecules that had worked for him. And so we ended up starting a cannabis protocol, starting with mostly like the CBD dominant non-psychoactive cannabinoids. But then, of course, this person wanted more relief faster, and they were struggling for a long time. So they just went to the dispensary and started getting their own stuff. And it actually worked. And they, it wasn't the kind of result that we saw with ketamine in a single session, but over the course of 6 to 6 months, this person went from chronically suicidal and struggling to stay on the earth and struggling to function to, again, engaging with their families, getting a full night's sleep, applying for jobs, starting to work a job, right? Like part-time and then full-time. And, these are radical transformations. Like this is like you're taking somebody who is costing, if you think about like untreated mental illness as being the single most expensive thing for our society on the whole, other than like defense spending. Untreated mental illness is the single most expensive thing. And we just took somebody using a plant that they self-administered, right, with some of our psychotherapy on the side, but they self-administered at home daily. And using that plant, they went from a member of society that was costing tens of thousands of tax dollars every single year at least to somebody who is now paying taxes based on their income, right? As a productive member of society. They're happier, they're fulfilled, they're now a contributing member of society. So like the society feels better. Everyone wins in this circumstance. And plant medicine has an incredible opportunity by embracing it and sharing and spreading the scientific knowledge and treatment protocols around it of how to help move the needle on some of these folks that Western medicine just hasn't been able to address. And not all Western medicine is bad. It's just it doesn't solve every single problem we have.
I think that's a really good segue and towards a question I like to ask a lot of people is, what is your ideal scenario, or just curious on your thoughts on the evolution of this quote psychedelic industry emerging. I don't think we want to repeat the mistakes and things that go on in the current pharmaceutical pipeline. So I'd love to hear your thoughts on how this industry evolves.
Yeah, it's a great question. We don't want to repeat the mistakes of the modern pharmaceutical industry. We also don't want to repeat the mistakes of the psychedelic world back in the 60s and 70s, where we released everything too quickly without testing, and then some people hurt themselves and ended up resulting in a lot of unfair bans and restrictions on research, right? So both sides we don't want. But there's also a lot to learn from both of those experiences, right? From the mistakes of the 60s and 70s, we know we need to be more rigorous and more careful and more thoughtful about the approach, more scientific. From the mistakes of pharmaceutical companies, we know that we need to be thinking more about our patients and the long-term sustainability of these treatments and how to make sure that they are fairly accessible to everyone in need as much as possible in an affordable way. And so I think, that being said, we're entering into an era in mental health that is probably one of the most exciting eras we've ever had. And I would say that it's akin to, if we were to try to draw a similarity to this time in mental health, in the current mental health world and where we're at with mental illness and treating it, and et cetera. And it's very similar to where we were with the discovery of antibiotics in 1908, right? So prior to 1908, we didn't have penicillin or any antibiotics. One of the leading causes of death prior to 1908 was infection that was untreatable. And if you got an infection from a cut, from a wound in your physical body, and it was not cleaned properly, and it got, infected, and badly so, without antibiotics at the time, they would have to amputate a limb or you would die. And that was one of the leading causes of death until 1908. Discovery of antibiotics, and penicillin is discovered. All of a sudden, within a 5 to 10 year time frame, we can now treat something like 80 to 90% of the infections that used to be considered a life sentence untreatable, right? You'd be sick for life if before 1908 comes around, we have a cure. Before 1908, we never could use the word cure for infection. After 1908, we can use the word cure for infection. So you think about that in the context of where we are with psychedelic medicines, where right now, at this point in time, and up until this point in time, we have never been able to use the cure word for mental health. We're not taught to use it. We're not taught we can do it. Anybody who's diagnosed with a mental health condition is told that they will be required to take medicine for life, or they will get sick again. And that's what the studies show. And that it's basically a life sentence with mental illness. And that is not acceptable. We can do so much better. And psychedelics are teaching us that. And they're teaching us through these studies that when you see that 54% of people who have had just three doses of MDMA assisted therapy for 42 hours over 12 weeks are entering remission, and that number goes up to 67% at 1 year with no additional treatment. 3 doses of medicine, not every day, 3 doses of medicine over 12 weeks. We are getting people as close to a cure for mental illness than we have ever seen for any mental illness. And PTSD is at the top of the list in terms of what we're curing. And I think the jury's still out on whether the cure word is appropriate right now, but the studies are really strongly showing that people are getting better in the short term and the long term, and the majority of people are responding in a very significant way that is resulting in continued benefit after the medication treatments have stopped. We have never seen anything like that in the history of mental health. That is akin to the discovery of antibiotics in 1908, right? We're in this generation, in our generation, for over the next 5 to 10 years, we're going to go from what used to be considered a life sentence, mental illness as a life sentence that was uncurable, to actually curing mental illness. And nothing could be more exciting than that.
Beautifully put. I'd love to definitely let our audience stew with that. Where can people follow you? Are you currently taking patients? Where can they learn more about Apollo, and where can we catch you next?
Yeah, absolutely. So anybody can follow me on my socials at Dr. David Rabin on Instagram and Twitter. I love to hear from you. I also have I have a psychedelic show, news show called The Psychedelic Report that's on Spotify and Apple Podcast. And then I also have a show on consciousness where we break down and deep dive into a lot of these complex topics with leaders in the field called Your Brain Explained, which is also on Spotify and Apple Podcasts. And then if you want to find my clinical practice, you can check out my website, drdave.io or apollo.clinic. And you can find Apollo Neuro, the wearable that I'm wearing on my chest. You can find that anywhere that wearables are sold, but I would check out wearablehugs.com, which is what the kids call it, or apolloneuro.com, APOLLONEURO.com. And you can find me next I don't know, when is this coming out?
This will be edited by the end of next week, so a week. It's 2 weeks, let's call it.
Okay. So I was going to say you can find me at Summit at Sea, but that's next week, so it won't be out yet. You could find me next at the Milken Conference in LA in May, and then at Upgrade Labs, presenting a keynote on multiple personalities and multitasking at the end of May in Dallas.
Beautiful. Is that part of the biohacking conference going on?
Yeah.
Wonderful. I'll see you there.
Sounds good.